Okay, we can start.
Om Pranam Sabiko. Today is Monday, 16th May 2022, and yoga session today will be done by Moniji and myself. So, Sabiko Pranam, Jai Shri Krishna, Ram Ram, Jai Mata Di. So, we start our prayer. We'll do 3 times Om in sitting in Gyan Mudra. Breathe in deep. Gayatri Mantra. Om Bhurbhuva Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Om Triambakam Yajamaya Sugandhim Pushtivardhanam Urvarupameva Bandhanan Mrityor Mokshemamrita. Om Asato Ma Sadgamaya Tamso Ma Jyotirgamaya Mrityurma Amritam Gamaya. Om Shanti Shanti Shanti. Sabhi ko pranam. So, first of all, we start with Brastika to energize our body to get maximum oxygen inside our body. So, we sit in Gyan Mudra and do Brastika for 30 seconds. Deep breathe in and breathe out. 10-second breathe in, 10-second breathe out. We start now. Breathe in. You do it in Chin Mudra now for 30 seconds. Breathe in. Relax. The next one, we use fist. When you go up, open the hands. When you come down, you breathe in. So when you go up, breathe in, and breathe out. Okay, start. And relax. So that's to energize our body to start with. So we now start with nitric oxide exercise, the full exercise including the humming, which I'll pass on to Moniji to carry on with nitric oxide with some explanation as well. Okay, so.
All everybody, as you know, my name is Mani Mistry. You all know. Welcome you to Yoga with Sam. Before we do any exercise, just health and safety warning. So if you are, unwell, please do not do it. Always take medical advice before do any yoga session or any physical exercise. So we don't want to harm you. So do everything safely and do whatever you can. Do it slowly if you can't do it fast. And if you can't do any exercise, you can do breathing exercise. So before I do nitric oxide exercise, just do some clapping. First, we just do the pressure point. So if we just rub our hands, and then we just do it. And then we do clap. So we just cup it. 1, 2, 3, 4, 6, 7, 8, 9. 1, 2, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 6, 8, 9. 1, 2, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. And do it last time. 1, 2, 3, 4, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 2, 3, 4, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. Just help to open up our lung meridian as well. We're doing a pressure points. So it just help to activate all our organs as well. Then the next one, I'm going to do some anxiety one. So Kapalbhati has done the other one, but we do we're going to start with Chin Mudra again, and then we do Adi Mudra, and then I'll do the other lung exercise. So we sit in a Chin Mudra upside down, and this will help to open up our lower part of the lungs. And going to do Kapalbhati, so please be careful. If you had a heart surgery or any other surgery within 6 months, do not do Kapalbhati. Ladies who try to get pregnant, going through monthly cycle or pregnant, please do not do Kapalbhati. But people who have high blood pressure or a heart problem can do it slowly, otherwise do Pastika. So it's a 1 second, 1 stroke. So you're doing 60 per minute, and it's a forceful breathing out and you're breathing in at the same time. So just do whatever you can. So for 30 seconds, we do Pastika first. And use the same mudra we do Kapalbhati. And relax. Next we will do Adi Mudra. So thumb in, and then make a fist. And on your knee is the first mudra. So I do Vastika, 15 seconds. This helps to open up your upper part of your lungs. Use the same mudra with the Kapalbhati. And relax. Next, just going to open up lungs. So if you stretch your legs if you want to, and you breathe in, and you go out, and then open up your arms, and you breathe out. You do 10 times. Last one. And relax. Next, you'll put a hand on your shoulder, and you're going to swing as you breathe. You're doing the Vastika, you breathe in and out. And relax. We done the hands, so we won't do that one. So next one we'll do that. Anxiety one. Anxiety, everybody is suffering at the moment with the COVID going around. So what we'll do first, we'll just breathe in. So we just take raise your hand and we take a deep breath. And then you blow out as you blow in the straw. So again. And relax. And next, you do that thymus gland. So if you go to thymus gland, just you got your thyroids there, and just come down further, and just between your sternum is your thymus glands. Either you tap it, or you can do Kapalbhati. So we can tap it and explain to you. The thymus gland releases the hormone called thymosin, and it produces T cells, the white cells that help fight infection, and also increase your immunity. It's very good when you're stressed out and you want to increase your immunity. You do this, or you can just press it there, gentle press there, and do Kapalbhati. And relax. Next, we will do the coughing. So you breathe in 3 times, and then 4th time you breathe in and you cough. This will help to remove any phlegm on your lungs. If you got chest infection, or if you're suffering from lung disease, this will help. And also this will help to clear your blocked arteries and help you with a heart attack as well. Or we prevent the heart attack. So we take a deep breath. You can sit any mudra you like. Again. This time we'll breathe and cough. Again. Sorry, I got too many people on. Do one more time. relax. Next, we'll just do Bhastika for 1 minute, 1 or 2 minutes, and then we do nitric oxide. So we sit in a Gyan Mudra on your knees. Gyan Mudra helps you to concentrate. It helps you to relax. It also helps you to lower your blood pressure and prepare you for the meditation. You concentrate on your third eye. And you do with the Khichdi Mudra. Khichdi Mudra is you lift your tongue up and touch the roof of your mouth, your palate, and it will stimulate, you activate your vagus nerves, and that stimulates your parasympathetic system. So that will also help you to relax and also lowers your heart rate as well. And so we just take a deep breath. It's 2.5 seconds to breathe in and 2.5 seconds to breathe out. Khichdi Mudra give you a longer breath as well. So you take in more oxygen. So 2.5 seconds to breathe in. You take in more oxygen into your lungs. And as you breathe out, get rid of your carbon dioxide and other toxin. This will help to improve your blood circulation. It purifies the blood. Increase your brain function. Good blood circulation. Increase your lung capacity. Even your clean lungs give you clean immunity. Controls your body temperature. Balances your hormones. And because you're doing 2.5 seconds to breathe in, 2.5 seconds to breathe out, using your stomach, and give you, and also exercise your internal organs. And this exercise, it can anytime. Just rub your hands. Open up it and put it over your eyes. Slowly open your eyes and massage it everywhere. Massage your face. Next, I will do that. Explain the nitric oxide, and then we do jogging, and Surya Namaskar. So, hope you don't get fed up me going on about nitric oxide, but nitric oxide is very important at the moment. So we want to keep our lungs healthy. So nitric oxide is a gas that comes like a bubbles. We call it tiny molecules that they are in our cells of our human bodies. So when they burst, they will open up your blood vessels and open up your lungs. So when they open up your lungs, when you have a stiff lungs and when you got infection, you can't get rid of carbon dioxide. So nitric oxide will help to expand your lungs and will take in oxygen, and it will get rid of carbon dioxide and other toxins that you have in your lungs. So when the oxygen goes in there, it purifies the blood, because blood will it purifies the blood and it will keep our blood vessels healthy. Yeah, our tiny veins. You know what the nitric oxide does when the bubble blows, it open up your blood vessels, and it will all the veins will open wider. So we call it dilation. It's called a vasodilator. So it will dilate the blood vessels, so blood can flow easily, and it doesn't get sticky. So very flow easily. And if you have a high blood pressure, it will lower your blood pressure. Otherwise, it will maintain the blood pressure, because it will maintain it will go through with a normal pressure. So it will maintain the normal blood pressure. So it's very important that we have oxide to keep our blood vessel healthy and our lungs healthy. And it's also, because it's an inflammatory gas, It will clean all bacteria, viruses, and also there's a lot of research going for COVID-19, and it does help to expand our lungs and it help you to make better. And it, as I said, increase the oxygen level as well as is your energy, because you get more oxygen, you will get more energy. And it'll also give you, it also treats if you go sinusitis or allergy, because you, when you breathe in every day, you are taking nitric oxide, but we need to make it more. So we've got to make sure that our nasals are clear. And if you got sinusitis, this is a good exercise to clear your sinuses as well. And it's also helping throat cancer patients. They have been using nitric oxide. Sarvanji has done some research on that one. And yeah, and also any allergy that you have. As we age, we make it less, you know, everything slows down. So we need to make lots. We need millions of those bubbles to keep our lungs open. So how do we get it? So we get it through eating healthy food. We get lots of green vegetables, leafy vegetables, and like celery, beetroot, broccoli, dark chocolate, have it as well. And you mix it, you chew it properly, mix it with your saliva, and then it goes down into your stomach, mixed with your acid, and then you turn it into nitric, and then when it mixes with the oxygen, it becomes nitric. Goes into your intestine, and then it goes into the blood, and it just circulates around the body. So make sure that you do not use chemical mouthwashes, because it will destroy the good bacteria in your mouth that helps to produce nitric oxide. So use salt gargles, but if you have a high sodium level, if you're suffering from high blood pressure, or if you got kidney problem, swelling, try to avoid salt gargle, because salt gargle can, if you do a lot of salt gargle, it can absorb some salt in your body. So use, you know, lemon or oil or any other gargles you can. And 1 or 2 gargles will not harm you, but it's better if you don't use a lot of salt gargles if you got a problem. So the next thing is you're going to do humming. The humming will open up your nasal passage, and you're making humming sound by closing your ears. You close your teeth, bite your teeth, and you put tongue against your teeth, and you take a deep breath and you make a humming sounds, and that will help to produce nitric oxide. Om, humming, and brahmi, they all help you to make nitric oxide. And if you are suffering from any of the allergy or lung infection or going through a COVID pandemic, please do this exercise more often. And blowout exercise will just help you to feed your muscles, and it will help to circulate around your body. So that's when we do the blowout exercise. But if you can't do blowout exercise, you can do humming. Humming will help you a lot. So we will take our, if you have, close your ears, and then bite your teeth and put the tongue against your teeth and do humming for 5 times. Last time. And relax. One more thing I forgot to tell you, they always breathe through your nose, because your nose will filter, you got nasal hair that will filter your air, it will trap all the dirt you have. And when it goes through, it will purifies, it humidifies with your mucous membrane. So you take in humidified air, so it doesn't damage your lungs if you take the dry air. So do not breathe through your mouth until you have a problem, or unless you've been advised by the doctor, because sometimes some people have a nasal problem. but they need some treatment to prevent lung infection. So whenever you're ready, we'll stand up and we'll do some blow-up exercise. If anybody joins in, have the mic on, please mute yourself. So let me just stand up. We do it twice and then we do jogging again. Do whatever you can. So do it. We'll do 4 steps. So we do some squat first. So breathe in and out. Relax. Next, we'll do a walk. And relax. Next is a star jump. And relax. Next, we're going to do lifting up the ball. We do one more time. First, we can deep breath. So we just scoop up some energy, a deep breath, and blow out. Again. And blow out. One more time. And relax. And then we start again one more time. And next we do that. One. And relax. Next, we do star jump. And relax. Last one. And relax. Take a deep breath if you want. While I explain, I'm going to do jogging. Again, it's a full body workout. So do whatever you can. Do not bend forwards if you've got a back pain, and if you've got hernia, don't go backwards. And do it slowly. If you can't do it fast, you don't need to do fast. And do whatever you can. You don't have to do the numbers. You can just stop whenever you can and do plastica. So we just start jogging. going to breathe in and out. So this is again, sorry, just carry on. I think somebody's got a sound on, you know. I just want to try to. Please do not mute yourself because this interferes with people. And next, we just put the hand up and legs going up. If you can. Next, we do this. And then, you can find it hard. And then you take the opposite leg, the opposite elbow. And then clapping. And relax. And then we do, either we do squat or you can do the three of this. And then you do with the hands if you find it easy. Breathe out. Breathe in, breathe out. And you do the knee exercise. On the front. Hand on your knee to support it and do it 5 times clockwise. 1, 2, 3, 4, and 5. Reverse. 5, 4, 3, 2, 1. Take the part, bring it in, and go 1, 2, 3, 4, 5. Reverse. 5, 4, 3, 2, 1. And then legs apart, hand in the front. You breathe in, bend the right leg, left leg straight, breathe out, and do the other side. And carry on. Do it slowly, if you can do it fast. And you can bend as far as you can. And relax. And bring legs a little bit inside. Go on the left leg straight, right leg bend, hand on your knee, and breathe in, bend it, and look up. And breathe out, go other side. Right, left. Next, hand on your hip and your waistline. Right, left. Next, interlock your finger, index finger, both touching together, and bring it up, look it up, breathe out, left, right, left, and relax. Next, we're going to expand the lungs. So you be careful if you've got a pain, back pain, don't go backwards and forwards if you go hernia. So breathe in as you go up, open your arms, and then breathe out, come down. 3 times. 4, 5. Last one. And relax. Next, we're going to bend. So left leg a little bit out and right hand up. And then slowly, slowly come down. You can slide your hand and then bend down as far as you can, touching your knee, touching your calf muscles or ankle or toes. as far as you can. If you can't, just do the triangle. Asana is like a triangle. So you can just stay like that. Otherwise, you just go bend down as far as you can, then go on the side. And relax. Next, we're going to open up lung and we're going to touch the opposite toe. So again, same thing. Just touch as far as you can and breathe in and out and you look back as you go up. If you feel a bit dizzy, don't do it. So breathe in and touch opposite toe. And relax. Next, we're going to bend forward. So it is good for your back as well. So you breathe in, and raise your hand and take it back, and then you breathe out. Go down as far as you can. You breathe out again. You do 10 times. And 10. Relax. All right. Next, we're going to do star jump. If you're tired, just take a deep breath. Next one is a star jump. So you do slow one. 1, 2, 3, 4. 1, 2, 3. 1, 2, 3. 1, 2, 3, 4. Next, I'll do with the jump. If you want to do it. 1, 2, 3, 4. 1, 2, 3. 2, 3. 2. Do the fast one. Who wants to do the fast one? And we do it 10 times. So we'll make you work hard. So we do it 1, 2, 3, 4, 6, 7, and relax. Next, we're going to do Tadasana. Tadasana is good for maintaining your height, and for the children, it increase your height, and also it's good for the digestive system, and it's stretching your lungs as well at the same time, strengthening your lungs and your ribs. So interlock your finger, hand on the head. As you breathe in, you go up on your toes. Just hold it for a few seconds. You can hold the breath, or you can just breathe in and out, and then breathe out. Again, 3 times. Last time. And then legs slightly apart. Then breathe in, go up, and then go one side. That's helping you again. Exercise your internal organs. 10 times. And then go other side. You also straighten your hands, your arms, your waistline. And relax. And now we're going to do twisting. Again, it's going to exercise more. So you hand in the front, you breathe in, and you take it back. Breathe out, come back in the front, go other side. So this is, you do this exercise when in the morning when you get up to help you, for your constipation, be able to move your bowels properly. And the next, your right hand on the left shoulder, left hand behind, and then you look back as you breathe in, hold it, breathe out, other side. And relax. Next, we're going to do the Jigadang. So you go good for the hips. 10 times. and reverse. You can do this while you're in the kitchen. You don't have to do the twisting, but you can go around and do it like this in the kitchen. Now we're going to do the twist. So hand goes the opposite, your feet goes the opposite. Now breathe in and out as you do it. And relax. Just take a deep breath. Just do the tapping a little bit. We're going to do Surya Namaskar. I'll do the standing up and Kapalbhati will do with that.
Yeah.
The chair. Yeah. Get the chair ready. Yeah. Ready for the Surya Namaskar?
Yeah.
Oh. Right. Again, this is also a lot of stretching. So please, you don't have to do it. If you can't do it slowly, sitting in a chair. So we will do 3 steps, three sets. This is Surya Namaskar, saluting the sun. My sun is facing that way, so I'm facing that way. And it releases good hormones as well. So we go into number 1, Namaste. Then you breathe in, raise your hands, and take it back as far as you can. That's number 2. Number 3, breathe out. Bring your hands down beside your feet. When you breathe in, take the right leg back, and you're looking up. 4, take the left leg back. The mountain position. Number 5, and then you breathe in and out. You breathe out. As you come down, bring your knees down, your chin in the chest. Number 6, you breathe in and come to Tadasana. Number 7, breathe out to number 8, mountain position. Number 9, bring the right leg forward, looking up. Number 10, bring the left leg forward. Number 9 and 10, both legs in the front now. And then number 11, you breathe in, come up again, bend back, and breathe out to Namaste, number 12. Right, so we do with the left leg, we do numbers. 1, 2, 3, left leg back, 4, 5, 6, 7, 8, 9, 10, 11, 12. Again, right leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Left leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 1, 2, 3, right leg back. 4, 5, 6, 7, 8, 9, 10, 11, 12. Last time, left leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. And relax.
Well done.
Everybody's sweating, made everybody work hard. Just sit down, just take a Deep breath. Take a deep breath. Just the Gyan Mudra before we do some leg exercise. Just relax.
Yeah. Okay.
We'll do some leg exercise. So we'll do some stretching. And then we'll do some hand exercise. We do whatever we can. We just put this way. So we just loosen up our muscles. If you have one bit stiff standing up doing the exercise, and let's massage it. We worked on the leg already. And then we put her, just do one more knee exercise. So hands again on there. So you breathe in and lift up, down again. We rotate the knee. So now we're just going to do up and down and relax. Now we're going to wriggle our toes. Toe exercise. This is good for the arthritis, gout, and for the cramp as well. If you have the cramp, the Sarvanji says, you bring your toes forward, raise your hand, and then you go back, and that will relieve your cramp, and then come back. And you do that when you have a very, very bad cramp. You release it. And then you breathe in and out, bring the toes forward and back. And you breathe in and breathe out. Breathe in. This is good for the gout. I said arthritis. Gout is building of uric acid in your kidney. When kidney can't cope with it, it will spread on in your joints, causing a lot of inflammation, pain, even swelling, and you are unable to walk properly. So this exercise helps you to, and this also helps you to release any swelling in your on your feet, on your ankle. You rotate clockwise. And reverse. 8, 7, 6, 5, 4, 3, 2, 1, and relax. You can always hold it to the hand and you do it if you can't do it, or ask somebody else to do it. As Dr. Kapoor always says that. Okay, if you got grandchildren, they can help you to do all this. Next, we're going to lift. So support your knee and do 5 times. Lift up. 1, 2, 3, 4, 5. And rotate. 1, 2, 3, 4, 5. Reverse. 5, 4, 3, 2, 1. Cycling. 1, 2, 3, 4, 5. Reverse. 5, 4, 3, 2, 1. And do the same with the other one. You can do the more numbers in your own time. 4, 5. Rotate. 1, 2, 3, 4, 5. 5. Reverse. 5, 4, 3, 2, 1. Cycling. 1, 2, 3, 4, 5. Reverse. 5, 4, 3, 2, 1. And relax. All this exercise done while you're sitting down, relaxing. You can do it. And next we're going to If you can't bring your leg over your thigh, do it there. You can see me all right there. I'll go a bit far away. And then press it down this way. Otherwise, bring it on your thigh. And then you support your ankle. And then with your right hand, bring your knee up. Breathe. And then you press it down as far as you can. Hold a few seconds. And then breathe out. And then come back again. 3 times. Down. Again. Yeah. Now we're going to rotate the ankle. So be careful if you got bad arthritis or got joint pain. Do it slowly and gently. This will help you to release some fluid in your ankle as well, in your feet. Reverse. Then we do all the pressure points on the top of your toes and sinuses. Top of your big toe is the sinus as well. Just underneath is for your brain. And then you go down and it's your thyroid. And then between the second and the third toe is your eye points, pressure there. And between the last 2 toes is your ear. So all this pressure point. And top part of your foot is your lungs and your heart. So if you got any pain anywhere, you have a problem. So you need to look into it. Then come down in the middle, your internal organ, your liver, your lung, your liver, your kidney, your pancreas, your spleen, your stomach. And the lower part, as you go down, is lower part of your body, your intestine, and the other side is your spine. And also we have all the front, so channels there. You just give it a press between the big toes is the liver one. And then massage it and further just tap it and then hold like a baby and we will rock. Ha 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 ha. Give it a good hug. And we do the same with the other one. So support again. Lift up, breathe in, breathe out, breathe in, breathe out, in, and breathe out. Or you press it down. And then do the same thing. And again, to stimulate more your organs, walk bare feet or indoors, and even when you're outside, and walk backwards to correct your spine. So don't fall over, because you will injure your back. So you do it slowly. So the pressure point, all this again. All the pressure point. Down the middle, at the bottom, at the side, and in the front. It's very good when you're sitting down and massaging, and then tap it. And then hug. And relax. And we do the tickling, it's butterfly. This is again pumping up your lymph fluids, your sciatic pain, and also help to reduce the fat around your waistline and on your stomach and on your high calf muscles. So you do more, you're just sitting down. You want to lose, muscles around there. I think Takuba is going to do hand and neck exercise after this.
Yeah.
So whenever we're ready.
Then we sit down in any posture, Sukhasana, Siddhasana, or whichever comfortable position you are in. So we have done our leg up to hip exercise. So one more hip exercise you want to do, you want to twist your hip whilst you are doing on the leg. So what I would suggest that you stretch your leg out, put your right leg up, right hand goes at the back and left hand goes there. Try to touch your knee and you breathe out and twist. And do Kapalbhati for 10 times. And change. 10, 20 times is good. The next, raise your left hand, left leg, left hand goes back, right hand comes down, and try to touch your knee. Look on your left and do Kapalbhati. And relax. You can do it 10, 20 times. The next one is, we have done this on this side, but you can also take it on the other side, which is also good, and you can do the same thing and breathe out and twist. So you want to twist your waistline, so it sort of releases all the joints. And the Kapalbhati and change. Take it on the other side. Left hand goes back, right hand comes on the top, and breathe out and squeeze. And relax. It's a good exercise. તમને કમરમાં કંઈક પેન હોય દર્દ હોય કંઈક કમરમાં કઠણ થઈ ગયું તો you can just do this exercise for a few minutes and you can release your kamar pain. So we'll do now our hand and head exercise. So hand in the front. So twist your fingers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. When you do that, you are pressing all your fingers to all your energy points, or you are pressing all your organs, liver, kidney, heart, and everything. So this is very good exercise. The next one is you muthi 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Again, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now put the muthi and turn 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Reverse. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Can open up. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10.
My
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You can go up to 20. So I want to try to touch your elbow together and bring it out. Go as back as you can. Back plate. Pachwani back plate. So try to bring back plate close together. So it's good for your frozen shoulder as well. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Reverse. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now move shoulder. 1,
love
2,
your stuff, yeah.
3, 4, 5, 6, 7, 8, 9, and 10. Reverse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Up and down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now lock your hand. Go up. Take it on your left or right, whichever comfortable position you can do, and try to pull it. It is all part of your shoulder exercise. Last time. The next one is our head exercise. Because we have come up to here, so we'll do our head exercise. So we will do the pendulum on your right and your left, on your right, on your left. One more time on your right and left. Now you look down. When you come up, breathe in and look up. Breathe out. Breathe in, come up, come down. Breathe in and down. Last time, breathe in and down. Now look on your right. Go slowly, turn slowly on the right as far as you can. Come back slowly in the center. On your left. Again on your right. On your left. Try to go as far as possible at the back. If you are driving, you always want to look back without straining your neck. So this exercise will help. So we'll now go clockwise 3 times. Look down and breathe in and come up slowly. And when you are at the top, breathe out and come down. Up and down. One more time. Up and down. So next exercise is for your eyes. So normally you have this diva and you concentrate your eyes on the diva. There is one thing which if people are doing a diva exercise, try to put your diva or a candlelight in level with your eyes and try to look at the diva, concentrate without blinking. You do it, if you have a ghee diva, that's good, but if you have an ordinary candlelight diva, you can concentrate your mind, just keep cool, look at it without blinking, and to get the most benefit, you will see that after a few minutes, you got tears coming out of your ears. So until the tear comes out, you look at it, and that will help your eyes for a better health. So that's the diya thing, but for we haven't got diya, so we use the thumbnail and move it on your right slowly. Go slowly. Head stays straight, only the eyes moves, and come back slowly. And you can change and go on your left. Come back slowly. Again, you can come back near to your, bring it to your nose and concentrate. Again, you can do it 2 or 3 times whenever you can do this. This is a good exercise for your eyesight. So we'll turn around our eyes clockwise 3 times. Left, top, right, down, left, top, right, down, left, up, right, down. Reverse, right, top, left, down, right, top, left, down. Last time, right, top, left, down. You can continue circulations whenever you can. So that's good exercise. So the next last one is put your for the head exercise. Push it there. Press it hard twice. Breathe in. Press again. Breathe in. Press front. Breathe in. Press. Breathe in. Press on the side. Breathe in. Press again one more time. Breathe in. Press on your left. Breathe in. Press. Breathe in and press and relax. So that's our hand and head exercise. So the next one I'll pass on to Muniji to can continue.
We do some Kapalbhati now. So again, Kapalbhati health and safety warning are already given, so please do not do it. If you have got any heart problem, high blood pressure, do it slowly. If you're women who are pregnant, try to get pregnant. And whoever's had a surgery within 6 months, please do not do it. Do it Pastika. Kapal means forehead and Bhati means glow on your face. So I hope you're all glowing. And it's Kapalbhati is a forceful breathing, as I explained to you before. So it helps you exercise your internal organs. Same time, you straighten your lungs as well. Increase your lung capacity and boost up your immunity as well. And also, it's reduce the fat on your stomach. So first of all, we'll just straighten our spine. So sit in a comfortable position and then interlock your finger. And you raise your hand, neck is straight, and we do Kapalbhati for a few seconds. And relax. Next is the Sahaj Sang Mudra. So interlock your finger, both thumbs together. Do it. That's also helped you with the slip disc and your flexibility of the spine. Next, I will do Sang Mudra. So hand, thumb in there, all your fingers together, bring all the fingers, other one on the top, and your index finger touching the thumb. It's called Sang. This is good for the thyroids and also for the digestive system. So if you've got thyroid problem, you go. And also for the spine as well. Then we change over to the other hand. There. Yeah. And put it. And relax. Next, we do Udan Mudra. We'll do Maruda Mudra and all that next time because we won't have enough time. So we do Udan Mudra. Udan Mudra is touch all your fingers with in your thumb and you put it over your shoulder. And this is for the thyroids and for the speech, stamina, and also increase your voice. You're doing twisting, it also exercise your internal organ. It gives you more benefit. and relax. We do it short time because we don't have enough time, but you do it longer. Must do it at least 3 to 5 minutes. Next is a Vayu Mudra. It's for the gout, arthritis, and any gas formation in the stomach. So we do that. And relax. Next is Prana Mudra. Prana Mudra is your little finger and your ring finger touching the thumb. This is good for the eyes, good for the immunity, and good for your prana. I give you a lot of prana, means energy. It's the most powerful mudra. Do this whenever you have time because it's give you a lot of energy. And relax. We do grind. Prana mudra, you don't have to do it with Kapalbhati. You can do it with Bastika as well. So longer you do it, is better for you. Just going to do some grinding. Again, we do with the Linga Mudra, so that will help you to reduce the fat. You breathe in, make sure your hands are straight. You breathe in as you go back, and you breathe out as you go forward. So breathe in and make a big circle. 2, 3, 4, 5, 6, 7, 8, 9, 10. And then reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And the legs apart. And I'm going to touch the opposite toes. Looking at the back. People who can't go further, just do that. So opposite toes and breathe in and out. Looking up. And relax. Next is the Makhan. We do 20 times. Right? And 20. And relax. I have to count silently, otherwise I won't be able to breathe properly. So I always do it. So you can do it, your proper exercise. So next I will do Apna Mudra. So that's to relieve toxin from your lungs, from your kidney, from liver. So we put it at the side and we twist again. And relax. Next is the Surya Mudra. So it's your ring finger, press with the thumb. This is Kapalbhati, and it's good for the cholesterol levels, lower your cholesterol levels, also for weight loss, and also all liver-related problems, and also good for the diabetic people. and relax. Next, we do Apana Vayu Mudra. So your index finger, and then pressing the thumb, 2 fingers, next 2 fingers touching the thumb, little finger up. And this is good for people with a high blood pressure, also any heart problem, and also very good for climbing up the stairs. And relax. Next is a little finger touching the thumb is a Varun Mudra. This is good for your skin, if you got skin problem, eczema, and also helps you with the allergy as well. And relax. Next, Linga Mudra, low blood pressure, and also for the asthmatic people, and also increase your body heat. All these mudras all got different benefits as well, but you concentrate whatever problem you have, and you do it longer. And if you can't do Kapalbhati, just do it with the Bastika. It will improve and just increase your time up to 5 minutes, or you can do it for 10 minutes. More you do it, more benefits you have. You can start with a shorter time, do it 2-3 times a day. Then relax. We do everything we're doing is for prevention. So Bandhakasana is also prevention of diabetic, any gastric problem, any intestine, any digestive problem. So this is good. After your heavy meal, if you sit in Bajasana, it will help you to digest the food as well. So this Bandhakasana is also prevention of diabetic, as I mentioned, and diabetic people should do it before the meal, 5 times and 3 times a day. So what we do, we're going to make a fist, and then you're going to put it between your navel, and you're going to breathe in. When you breathe out, put it against and you slowly come down, bring it down, and then you look up, and then look up Kapalbhati 10 times. And then you breathe in and out, and you come up. People sitting in a chair can still do it slowly. Again, we do one more time. Come down, look up. And come up slowly. Then you put over your fist, over your liver and your pancreas, and over your spleen. Then you breathe in, breathe out, come down if you can, and then you look up. And you come up, breathing in and out, come up. Next, if you can't bend down, so you just put it over your hands, to put your hands over the spleen and your liver and your pancreas, then you just do Kapalbhati. And relax. We're going to do massage it. So left hand over your liver and your spleen, and the right hand over it. Take a deep breath. Breathe out. Come down. Press in stomach and then look up. Then do massage or do Kapalbhati. And then breathe in and out and come up. And draw out the side. So right hand over the left, over your spleen. Left hand over and breathe in. Breathe out. Come down. Look up. Then breathe in and out and come up. Then we do that. So I think it's Tadasana. So it's the child pose. So you breathe in, bring your hand, go back. Then you breathe out, come down, looking at your knees, massage it on the Kapalbhati for 3 seconds. One more time, breathe in again. Go back and breathe out. Then relax. Just going to along belong for a couple of minutes, and then Thakurbai will do Ujjayi. So when you along belong, you are breathing from the right nostril. So either you do in a Gyan Mudra or Vayu Mudra or Surya Mudra. So whichever mudra you suits you. So what you do, you press your right nostril, and then you breathe from your left nostril. Then you close your left nostril and you breathe from your right nostril. And then when you sort of breathe out, and then you breathe again with the right nostril. So it's called alternate breathing. So right side is your sun, so you're taking in hot air. Left side is your moon, so you're taking in cold air. And always start with the right side. And if you have a pain, you can just support your hand like that. And then if you get tired, you can swap with the left hand, but start with the right hand. So we start. So close your right nostril. Then breathe through your left nostril. Close your left nostril. Breathe out through the right nostril. Then breathe again with the right nostril. Carry on. You can do with the Khichdi Mudra as well. All this help to stimulate you, activate your vagus nerves, help you to relax, calm you down. Give you, you're taking in more oxygen, breathe in 2.5 seconds to breathe in, and 2.5 seconds to breathe out. And you're getting rid of the carbon dioxide. Purifies your blood. Even a good blood circulation, good brain functions, because you're taking in pure oxygen. It helps to unblock your arteries, prevent heart attack, increase your immunity, lung capacity, fight infections, and help to produce new cells to kill cancer cells. More you do it, more you will benefit. Start from 5 minutes, then increase your time to recover from your illness. And this is done any time of the day, before and after meals, and in a fresh air, will benefit more. We'll breathe from the right nostril, and we'll breathe out from the left, and relax and go behind. Do Ujjayi. I'll let you talk about do the Ujjayi or Vaya Pranava.
Yeah, we'll do Ujjayi because we're running out of time now. So with 3 times breathing through your throat, the third time you no longer breathe in, and you uh, put your Jalandhar Bandh, and when you hold your breath as long as you can, and then come up, and breathe out with your left. So do it 3 times. You can start now. Hold it. Breathe out to your left. You can stay as long as you can. Again. Breathe out. Last time. And breathe out. Give a nice gentle rub to your throat. So this is a very good exercise for your throat, for your thyroid, and also people who are singing. The next one is Agnisar. Agnisar, you breathe in deep, breathe out, and I do up and down. Breathe in, breathe out. And relax. Once again, breathe in, breathe out. Last time, breathe in, breathe out. And relax. It's a good exercise for your exercising all your organs. We'll now do Brahmani Pranayam. So you close our ears with your thumb, your 2 fingers on your eyelid, your ring finger on your forehead, and you breathe in deep and do humming 3 times. Breathe in. You can rub your hands and give a gentle massage. And we'll do Om 3 times. Breathe in. Keep your eyes closed and relax. Take all the pressure off your body, of your eyelid, your shoulder, your brain, and just relax. Just yourself. For a few seconds. Continue normal breathing. Relax and rub your hands. Make it warm. Make it like a bucket, like a cup. Put it on your eyes. Slowly open your eyes and give a gentle massage to your eyelids, eyebrows, and your forehead, and on the side. And come down a bit. Open your two fingers behind your ears. Give a nice massage. Give a nice massage to your ears as well. And try to put pressure on your ears because there are lots of pressure points in your ears. And give a nice exercise to your ears as well. And your throat. Go up in the head. And come down on your shoulder. And your whole body. And just relax. So that's finished our session. So we'll now just do some roaring.
Pray. You do the prayer
Prayer.
first.
Do the prayer first, okay?
Yeah.
So with the prayer.
Om.
Om Sarve Bhavantu Sukhina Sarve Santu Niramaya Sarve Bhadrani Pashyantu Ma Kasyip Dukbhag Bhaved. Om Shanti Shanti Shanti.
May
May
all
all be happy. May all be healthy. May all enjoy prosperity. May none suffer. Om Shanti. Sabi ko pranam. So we roar like a lion now. Everybody take a nice position and get ready to roar. Breathe in. Lovely. Everybody is doing wonderful. And the last. Wonderful.
Om, Om.
Om.
Om,
Thank you,
Bhagavad
Maniben.
Maniben, it was fantastic.
Very nice, very nice.
Morning. Thank you, Ben.
Oh,
Thank
you are
you.
very.
Very nice session today.
Thank you, Maniji and Thakur Bhai.
Thank you very much.
Thank you, Maniben, Thakur Bhai.
Thank you.
Thank you.
નાનપણથી કરતા આવ્યા છે કશેનાથી નાનપણથી કરતા આવ્યા ઠાકોરભાઈ very good, very good. You are a really God gift, brother and sister, God gift. વધારે તો ભાઈ શીખવાડ્યું છે ને મને નાનપણથી એટલે
બરાબર છે.
Very good, very.
So it's all part of our exercise daily routine, and I think બધાને બેનિફિટ મળે. દરરોજ કરો છો, it's wonderful. At least 1-2 કલાક તમે કરો છો. It's brilliant, you know. It's good for our health, and it improves our immunity as well.
Yeah,